And then I also serve as the Director for Behavioral and Implementation Science at the International Vaccine Access Center. I'll go ahead and turn it over to you, Molly.
Thanks, and I'm Molly Sauer. I am a research associate in the International Vaccine Access Center in the International Health Department as well. Great, so thanks all for having us today. We are going to talk a little bit about misinformation around COVID-19 and some of the learnings we have from the vaccine hesitancy challenges that have been seen and some of the anti-vaccine movement over the last several months and years. When we talk about this issue, many people should be familiar with this image that you see on the screen of some of the protests that have been happening around cities and states across the country, trying to stem the interventions that have been put in place to try to slow the transmission of COVID-19. So these protesters calling for ends to business closures and school closures, to limiting the restrictions, requiring masks to be worn, the range of interventions that have all been put in place for public health reasons. And what we've found is that in many cases, the arguments and the perspectives that we've seen here, and in some cases the individuals themselves, are the same as those are documented for the anti-vaccine movement and some of the vaccine hesitancy challenges that have really become quite commonplace in certain settings here in the US and around the world. Next slide. So before we dig in, I just want to quickly overview what we mean by vaccine hesitancy. And so the image that you see on your screen hopefully can give you a bit of a taste. This is really not a black and white issue. And when we talk about vaccine hesitancy, there is quite a range included. So on the far right-hand side of this, you can see in blue our accept all categories. So these are those individuals who are accepting vaccines as recommended, who are getting their full schedule as much as possible, and are generally supportive and on board with the idea of immunization as an intervention to protect themselves and others in their community. And then on the far left-hand side in red, you can see our refuse all category. So these are individuals who are opposed to getting immunization for themselves and others, and in some cases are vocally opposed to it. So these may be our anti-vaccine voices, our vocal vaccine deniers, as well as those who are refusing for just themselves. But what we're talking about when we speak of vaccine hesitancy is really the center category. Those that are refusing, but they may have some questions, or accepting but have questions, and in some cases are being a bit selective. So they may accept some vaccines, delay others, and refuse others. And this is really the area that we look for interventions to try to address vaccine hesitancy, this section that may be able to move more to the right. Next slide. So what are the things that are driving vaccine hesitancy, and where are these overlaps with the COVID-19 anti-lockdown protests and some of the other challenges that we're seeing? So a lot of these are really consistent between these two issues. One is the idea of tyranny, that the government is overreaching, that it's infringing on individuals' liberties, and is really overstepping the role of a federal or state government, or in some cases local. The idea that authorities maybe are not the best voice, and as such, science becomes just another voice in a really crowded space. So despite the need for public health voices, for scientific experts to be at the forefront here, it's being crowded out by others. And then additionally, and perhaps most importantly here, is this idea of uncertainty. So as everybody knows, as we have a novel virus, we're dealing with the challenge of learning as we go. So every day we're getting new information that is informing our response. But in the gaps where we have uncertainty, that's really an area that is ripe for conspiracy theories, for concerns that can be perpetuated through these communities. And all of this really hinges around the idea of misinformation, which is what we're going to talk about today. Next slide. So there's really two components to misinformation that are important to understand. Misinformation itself is a bit self-explanatory. It's really the idea of false or inaccurate information or misleading information. And that doesn't mean that it's done intentionally. It's just information that is spreading and is no longer accurate. Disinformation, however, has some intent to it. So this is information that's designed intentionally to mislead others. An example that we have here, and one that we have seen already in COVID, is, for example, if a leader, a political leader or other talks about COVID-19 and highlights how it's no worse than the usual seasonal flu, despite all of the data and evidence indicating otherwise, that message is disinformation. That's intentionally sharing false information to mislead. When an individual like us hears it and believes it and then shares it with those that we want to, relay this important information to, that's misinformation. We may not know that it's false, but we're sharing it because we believe it, and that's spreading this inaccurate message. Next slide. So I'm going to go through a couple examples that we've seen over the last couple months around the COVID-19 pandemic and the response to highlight some of the misinformation that we found. So what you can see here is an image highlighting how Russia unleashed more than 500 lions on its streets to make sure people stayed indoors during the outbreak and to enforce those social distancing requirements. Despite maybe this being something that seems like not the worst idea to some, this is in fact fake and misinformation. The image itself is doctored. So this is an image from a movie shot in Johannesburg several years ago that has been overlaid with a news-like headline. And this particular example is actually from a website that can allow you to, can allow you to create these misinformation like images that look like news broadcasts. Next slide. Here's another one. So this particular point is highlighting that a bowl of boiled garlic water can cure coronavirus, and it's been heavily proven and is a great treatment. So of course, this is also misinformation that has been widely shared and has of course been refuted. Next slide. And then lastly here, we have one that I'm sure we have all heard, and in fact, I've seen on some posters here in Baltimore, which is the idea that 5G mobile networks are spreading COVID-19. They're really the source of this outbreak and speeding transmission, which is certainly false, but this particular misinformation message gained so much traction that the WHO created graphics like this one to refute it, because it was spreading so quickly and so widely and really shifting people's perspectives. And I think a key message across all of this is, as hopefully you've seen through these images, social media is really a key challenge in this environment. Information is spreading faster than ever. It's reaching individuals through personal networks, which creates this automatic trust in the message that's being received. And it's really important that we factor that in as we try to deal with misinformation. Next slide. So on top of all of this, while some of these maybe seem more entertaining to us than anything else, or seem like they may be easily refuted, it's really important to remember that there are very real public health consequences for misinformation like we've seen so far with COVID. For example, there have been messages that colloidal silver is a great treatment and cure for COVID-19, and that can be incredibly dangerous to consume. And certainly most of us have heard the messages that cleaning tools like bleach are another strategy to protect yourself, which is of course a serious health consequence waiting to happen. So it's really important that we recognize that as we start to talk about misinformation. And a unique challenge that we're seeing in especially a novel virus situation is that trying to distinguish misinformation from good information is challenging at the best of times, but with the information evolving as we go, it becomes a moving target. So each day as we learn something new about this virus, something that we thought was perhaps true yesterday may no longer be so. For example, there were early on in the pandemic, there were stories that taking ibuprofen was going to be very, very dangerous and should not be taken. And as the time moved on, those messages changed. So we have to adapt our messaging to address this hesitancy, these concerns, but recognizing that this is a moving target, really. Next slide.
So I wanted to pause here for just a minute. We were curious, we wanted to provide a few examples of some of the more interesting types of misinformation that we have seen. We were curious, and I don't know if folks can put this in the chat for those of you especially that are tuning in from other countries, some of the other types of misinformation that you may have seen that seem to be spreading. So if you want to put those in the chat, and we'll probably come back to them in a little bit, just so we can talk a little bit more about some of the strategies that were used. So one of the reasons, just to go back a little bit, one of the reasons that we care about this specifically, I would say, so Molly and I work mostly in vaccine science. And as you can imagine, a lot of the issues that we're dealing with as to why parents decide to either delay vaccination or refuse vaccination is rooted in misinformation. And one of the things that we're seeing as the COVID pandemic evolves over time, as states and countries are starting to reopen back up, is that we're seeing that the arguments are very, very, very similar. So this sort of begs us this question is, why are we seeing more misinformation and disinformation than perhaps in the past? And so, as Molly just mentioned, and there's been some work that has looked at this as well, social media is great in so many ways. It has sort of broken down a digital divide in a number of countries. It's allowed people to have access access to information that they did not have information to. However, the flip side of this, as you can imagine, is that it increases this risk or propensity of misinformation. You think about a news story that is essentially going to be fact-checked, right? So if a reporter comes to you and presents on something, they have to make sure that what they're reporting on is true. However, in social media, we know that's not the case. Anyone can post whatever they want, it can go viral, and the types of things that go viral, as you can imagine, are those that are a bit more sensational. So some of these more interesting cures, like the lion meme that Molly had put on earlier. The other piece I want to point out, from a behavioral perspective, is that because we're living in such a time of uncertainty, we have this natural tendency to think about, how do we explain what's going on in front of us? What are ways in which that we can logically talk about, this is why we're having to be locked into our houses, this is why we have to self-isolate. So this whole issue of uncertainty tends to, unfortunately, lead people to search for answers in more of these sort of conspiracy theories or misinformation. And this type of information is very much rooted in anti-science as well as vested interests. And if you look at the figure here on the right, there was an analysis that was done that looked at misinformation. And if you can see on the left side, you can see that 59% of stories in terms of what is being found of misinformation in this specific sample were reconfigured, meaning someone took something that was actually accurate and then they edited it a bit to make it misinformation. So it's reconfigured. So it looks real, it looks legitimate, it looks like people, a legitimate authority perhaps has posted it, but it's actually false. Versus the other 38% here in this small sample that this study looked at were simply fabricated, meaning there was absolutely no truth involved. And so to me, this just goes back to the point that Molly had said earlier, that it's really hard, it's a bit of a moving target, if you will. What is true, what is not true? Some of the work that we have been finding and some of the work that we've been doing overseas, as Molly just mentioned, is the recommendations have been changing very, very, very rapidly, right? So several months ago, we were told not to wear masks. Now we're told to wear masks. So this is what really makes it ripe, I would say, for more people to latch onto misinformation and spread it. So then the natural argument becomes, right, if social media is really one of the drivers, I would say, of misinformation, what is the response? A number of social media networks, including Facebook, Instagram, and Twitter, have come together to think about the ways in which that they can change their policies to try to crack down on this information. So for example, if you look on the left, you can see that this was an ad that Facebook actually accepted and allowed to be posted. And what it says is, it says, don't stay in. The faster this spreads, the sooner we can get past the worst of it and return to normal. Again, the one on the right, this was also accepted. This says, coronavirus is a hoax. We're being manipulated with fear. Don't give in to the propaganda. Just live your life like you always have. So as you can imagine, in this very uncertain time, there has been a lot of pressure that's been put on social media platforms to try to think about the ways in which, what is their responsibility in all of this with regards to managing and mitigating misinformation. So another way to think about this from, I think, a little bit more of a behavioral perspective, because I want to talk about some of the interventions we can think about to try to reduce the amount of misinformation that people are seeing about COVID specifically, is that if you think about misinformation, it falls into a bit of an ecosystem, right? The misinformation is essentially rooted in some sort of credibility, meaning it's built on an element of truth. So that slide I just talked to you about, that essentially, if someone is fabricating or reconfiguring information, they're taking something that actually was true, but then they're modifying it in a way to essentially meet their interests. So with this credibility source, as we're seeing a decline in authority, sort of this rush of anti-science, people want to turn to some sort of an authority figure that they believe. What is that authority figure? That tends to be their personal networks and opinion leaders within their personal networks. And the other piece that falls within this credibility sort of level, if you will, is this idea that you want to find information that's consistent with your own worldview. So if you really want to believe that COVID was built in a lab, and did not evolve, it came engineered in a lab, you will try to find information that confirms that. So that's part of that whole credibility level of the ecosystem. The other piece that social media, I think, really facilitates and is really a challenge for those of us that are trying to mitigate against misinformation is that social media has led to a lot of echo chambers, meaning you're not going to be confronted with a number of diverse sources, usually when you're posting on social media. You are friends with people that tend to think more like you, that have tendencies and attitudes, especially towards things that might be a little bit uncertain, have some sort of level of uncertainty about them. And what that does is that just creates this echo chamber. You're having the same information that's being passed around in this same network. But what this does from a behavioral perspective is that it allows you to essentially check out. So that means that you don't have to think about a message and say, is this actually true, right? You say, oh, this is within my network. I trust my network, so I think this information is true. The other piece that, as you can imagine, COVID-19 has presented a bit of this idea of a shared experience, that we're all in this together, that we're struggling through the recommendations, that we're trying to adhere to new sort of policies that our governments are now placing upon us. And this idea of being a part of a community and sort of banding together, the shared experience is another level of this. The last piece I would say that we can think about this again from more of this misinformation ecosystem type of approach would be this idea of norms. So for example, if you think that your friends are wearing masks, that is going to influence whether or not you wear a mask. In that same vein, if you think that colloidal silver, for example, might be used as a cure to cure COVID, and your friends think that way, you're going to be more likely to think that way. So we're finding that norms, meaning what you think others are doing and what you think others should be doing, are very much influencing whether or not you believe misinformation or not. So there's a couple of things. I don't want to be all doom and gloom. We want to talk about the ways in which, what can we do about this, right? How do we sort of fight against misinformation? How do we get accurate information into people's hands so that they're making informed decisions based on evidence? So the biggest issue that we're finding here is this issue of trust, right? The reason that people are starting to move away from authorities and not maybe take public health information as legitimate as perhaps it was 20 years ago is this idea of trust. And there has to be a way that we continue to build trust between government authorities in general, including public health authorities and the public. In addition to that, one thing that we have heard over and over again is this idea of proactive information. So trying to get ahead of some sort of an issue. So when COVID was starting to spread rapidly early in January, I think one sort of lesson learned, which would have been really useful at that point, would be to announce early what we know and what we don't know. Even if it's, listen, we don't know much, that would have definitely helped with regards to, I think, thwarting a bit of this misinformation and conspiracy. The other piece that goes along with this is this idea of transparency. One thing that I think that we have learned from the Baltimore response specifically is that we try to be very clear and say, this is the most up-to-date information we have today. Understanding that it might be different than what we told you yesterday, but being transparent about that. Because I think if government authorities continue to not be transparent, that gives, again, just more fuel to the fire as to why people are turning to misinformation and other sources that aren't science or evidence-based. And finally, I would say the other piece that lies in this is this idea of listening to concerns and conspiracies. I think sometimes it's hard as public health practitioners. We hear some of these myths and we sort of want to laugh at them, but we have to understand that people latch onto these for a reason. And that unless we take time to think about and understand why people might think a specific way or why they might believe that tigers are roaming the streets in Russia, then we're not going to be able to communicate to them and build that trust with them. A few other things from a more individual perspective, and we have learned this mostly from the vaccine space, I will say, is that it's really important that when confronted with misinformation, if you are speaking from perhaps somewhat of a level of authority, it's important to not correct misperceptions. We have found that if you correct a misperception, what ends up happening is that people will actually believe in that misperception even more. So again, important to not correct misperceptions and instead focus on the disease. So when someone comes to you and says, you know what, I heard that this was a ploy by the government, COVID was engineered in a lab for population control, you can say, that's very interesting. I want to talk about COVID. I want to talk about the severity of the disease, and I want to talk about the susceptibility of the disease. The other piece that we have learned, again, this is more from the vaccine space, is that when we're communicating is using something called a default. So when we're talking to individuals, what it does is it essentially moves them towards a specific way of thinking without telling them how to think. One way to think about this within the vaccine space is instead of asking someone, hey, you know, it's time for you to get your shot. Are you ready for your shot? You would just restructure that conversation just slightly. And instead you would say, it's time for your shot. I'm going to get it ready. So I think we can apply this also in the COVID context when we're talking about misinformation and the types of behaviors that we want people to engage in from a recommendation perspective. The other piece, again, this is just some of the work I wanted to put here on the right side. This is from the World Health Organization, where they have essentially something that pops up on their website that helps mitigate some of the information and knowledge gaps that people are saying. The other piece we should think about is how are people getting this information? And I know many of you that are working in other countries outside of the United States, a lot of misinformation is fueled on WhatsApp. It's fueled on these other types of social media networks. So we have to think about how do we innovate our messaging to reach those types of platforms. In addition, you know, the other piece would be thinking about misinformation as contagion. So the same way that we study a disease and the way that it essentially spreads through a specific population, we should look and track misinformation in the same way. And another piece I would say about this is an older theory that has been used in behavioral science that was developed in the 60s. And it's this idea of essentially exposing people to a weakened dose of opposing information to increase resistance. So what you're doing is essentially just the way like a vaccine works. You're inoculating the brain so that when you hear something that might be misinformation, you're more likely to, one, identify it, and then two, be able to combat it and refute it in a way that makes sense to you. So we want to stop there. We have a feeling, I know lots of you have been dealing with misinformation. These are just some of the interventions that have been tried and true. And again, as we mentioned, we're in such a time of uncertainty that we're trying to pull out anything that we can, essentially from an intervention perspective, as to how we can combat misinformation, because as you can imagine, it's really causing a problem with regards to not only adherence to recommendations, but as states and countries start to open up again, I think people are much more likely to dismiss, I think, the new guidelines and the rules that states and countries are imposing upon public interaction. And so maybe I'll just pause there. I don't know, Molly, if you have any other last minute conclusions that you want to say.
No, I think that we've covered it. And I know there's a couple questions in the chat and the Q&A, so maybe we can shift over to those.
Yeah, well, thank you guys. Thank you both for your presentation. I wanted to start by listing out, because earlier, Rupali, you had asked for people to note some of the misinformation that they'd heard. So I tried to collate that. And what I've got is plandemic, herd immunity related to ethnicity, steaming your nasal passages will directly kill the virus. Someone mentioned that prevention through deep breathing exercises, and this was seen in the US, Japan, and then translated for the Middle East. One of the ones I think that we're hearing consistently, so I'd love to get you guys to address this in just a moment, is taking hot baths, drinking and eating hot beverages. So really this idea of heat, right? Heat as something that will just kill the virus or help you, prevent getting the virus. And then finally, one participant mentioned that in Mexico, I mean, this is a little bit similar to what we're experiencing in the US, there was messaging from the president to not stay home. The Secretary of Education said schools will be back as usual. And there were officials who were rejecting the data, both for infections and death. So from our participant pool, this is what we're seeing in terms of misinformation. But there have been some questions as well about heat. So maybe you can react to those, and then we can get back to the Q&As.
Sure. Yeah. No, we're happy. I'm just scrolling through them now. So thank you for also posting on here some of the information. I know plandemic. I saw someone put that on there, which I think, as you all imagined, one of the major issues with things like plandemic is then it was taken down very rapidly, which then essentially what that did is it just sensationalized it. All of a sudden people were like, where can I find plandemic? They really wanted to see plandemic, right? Part of it, what's interesting to me in that perspective, and some of, I think, these pieces related to heat, I would just say from my view is that there's no scientific evidence behind this with regards to heat. You know, I know that there have been studies that have said that essentially transmission will slow, is my understanding, as the temperatures rise, and as especially those of us like here in the United States, as we hit summer months, it should slow down transmission. But my understanding is that heat is not a cure. I don't know, Molly, if you have heard anything else.
Yeah, no, I think that summarizes it quite well. I think a lot of this originated, you know, early on. The early cases that we're seeing were in countries that were not, for lack of a better description, you know, having a hotter climate. So there was some conversation, I know, in India about this of, well, you know, it's a hotter climate here, and so we don't expect to see the virus spread. And the more data that we gather on cases and deaths, the more that's refuted. And I think this is actually a good example of some misinformation that we've talked about a little bit, that some of the early, as Rupali noted, some of the conversations that have happened have been that, you know, at high temperatures, it can kill the virus or it can slow the virus. But that definition of what high temperature means is really key to that conversation. So that has in some cases been spun, as Rupali talked about, the different types of misinformation, where it's a fact that has then been taken out of context or has been modified a little bit to the conversation being, you know, over 27 degrees, the virus can't survive and therefore you're okay. So I think that it's actually quite a good example of misinformation and how factual information can be twisted a little or taken out of context to effectively spread misinformation.
Yeah, and I think a couple of other ones, I'm just looking again a bit on the chat here, this idea that the taking the hot bath, I see the one from Mexico, essentially, that the president of our country said not to stay home. 3 weeks ago, they said that they would open schools on May 18th. The other issue that I think that one thing I do want to raise here that several folks have raised on the chat is, what do you do when the government is spreading misinformation? And that, I think, is a really, really tough one, right? I think part of the issue is this, right? I think that from a public health messaging perspective, we have failed a little bit with regards to the way that we message and we communicate to the public. We tend to be very evidence-based, which is great, but we don't do it in a way that uses and sort of, I think, utilizes more of these interesting approaches like storytelling, you know, using a mother that has dealt with perhaps her child that was hospitalized. So I think that there is a way that we can try to combat that. You know, I always say this, and I think for me that has worked in the vaccine space for a while, looking at misinformation, is that I think there is a lot to learn. Like I said, the beliefs related to why someone believes misinformation are similar across those that are vaccine hesitant and those that are believing or spreading misinformation related to COVID. It's the same types of responses. And so my argument would be, you know, a lot of these folks feel as though the government is overreaching. What is the response to that, right? And I think thinking about the ways in which we talk about that. The other thing related to that is this idea of, how do we decrease people from feeling uncertain? And that, I think, is going to take a bit more of, like I said, it's hard for a public health official to come and say, listen, this is what I know today. This is all that I know today. This might change from tomorrow. That takes, I think, a lot of credibility, you know, that takes transparency. I think that's really hard for folks. But however, I think that goes a long way in building trust, because I think the piece behind all of this and why people are glomming onto pandemic or are trying to think about some of these other cures related to boiling water or hot food or whatever the case may be, is because, like I said, they're just uncertain. They're grasping for information. And right now, we don't have a cure, right? And so as a result, people are sort of finding these things and they're posting them on WhatsApp, they're spreading them on WhatsApp, because it's their way to feel as though they can do something. So anything that we can do to reduce this idea of anxiety or of uncertainty, I think would also go a long way. So just being empathetic, to be quite honest with you, so being empathetic and understanding that we're all struggling with this and we're all feeling a bit uncomfortable, I would say, with the situation would also help.
So Rupali, I think that you sort of answered one of our participants' question, which is really about how translatable are vaccine-related experiences to this sort of disease setting. But one thing I'd like to ask both of you is to reflect a little bit on strategies from that, right? So you both have extensive experience in that. And what are the strategies that you've used that you think might be specifically translatable here? I mean, you talked about being empathetic, but what are some other things that our participants might be able to take away? And I'm going to add to that question a bit, is in terms of how do you counter misinformation from people who aren't really coming to you with an open mind? And Rupali, I know we've talked a lot about this in terms of vaccines, right? Really, how do you break down some of those barriers, or can you even? And I think that's something that's very relevant to today. So I'll give it over to you.
Absolutely, Anna, and then maybe I'll go first and I'll turn it over to Molly. So I think in the vaccine space, like I said, I am a mother of 2 small children. And when my kids were going through the vaccine schedule and getting vaccinated, I had a lot of questions. That was very much seen as, oh, well, do you not believe in vaccines? And I said, absolutely not. I am just a parent that has questions. And I would really use that example for this situation as well, is that I think that people have questions and they have every right to have questions. And I think from a public health perspective, it is our job to be empathetic. It's not to necessarily confirm any misperception, right? We don't want them believing that colloidal silver is going to cure COVID, but it's also understanding that they're human and they're trying to do what's best for their family. They're trying to do what's best for themselves. And so I think that that actually goes a long way, is how do we show some empathy? And how do we show some concern and say, like, we understand that you have questions. Like, we all have questions. We're all trying to figure this out, but here's what I know. And here's what I would do. I think that goes a long, long, long way. And I think many people would be surprised how many, I think, clinicians and public health practitioners don't take that time to sort of be empathetic to the people that they're speaking with.
Yeah, I would absolutely echo that. That was exactly the point I was going to raise. I think what we've seen in some of our experience on the vaccine side is that need to be empathetic and kind of at all levels. So from providers needing to kind of create a safe space where parents feel comfortable asking those kinds of questions and feel comfortable saying that they're unsure about it. I think we perhaps in some settings have a tendency to be a bit prescriptive about this, to say, we know this is what you need to do. We know this is the right intervention, the right way to approach it. But that kind of messaging can, as we've talked about, kind of create that echo chamber where if you already feel like there's an authority telling you what to do, and then that authority tells you what to do, that's going to just reinforce those beliefs that there may be some infringement on your own rights or your own decision-making and autonomy. So having that empathy, recognizing that we are all, as Rupali said, it is an uncertain space, and it's okay to acknowledge that the information is evolving and things change all the time, and that they may get guidance one day that changes the next day, but creating that understanding early on rather than everything that I say is correct when I tell you it.
Sure. Christina Garcia asks, how do we combat the role that more traditional media plays in promulgating misinformation? Some news outlets actively push misinformation while others do it a bit more inadvertently. And media also seem to match on the small studies that aren't peer-reviewed and have questionable methods.
That is the $1 million question. I think we're seeing that a lot, especially with some of the new, for example, the new information that we're getting about Moderna and their vaccine trial. There's starting to be questions around that. There's questions around this whole idea of vitamin D and whether or not that leaves you to become more susceptible, perhaps, to not only getting COVID, but it's a more severe case of COVID if you do contract it. I think it is such a challenge. And I think that it's the same, it has to be the same way when people come to you with misinformation or they come to you with any information, right? Helping, I think, people go through and think about that inoculation piece. And I know Facebook, there's a number of studies that came out, and I think it was NPR that published on this last year, is how do you essentially identify if a study might be false or may not be necessarily coming up with implications that are true. I'm saying that with quotes. So I think part of it is also making sure that you're equipping the public that you're interacting with, because they are coming to you, because you might be a trusted source as an authority of information. How do you equip them to have the skills, I think, to read an article and to critically appraise it, which is a whole other issue. And I know there have been several studies from political scientists here in the United States that have done this and have examined a number of different interventions to see what might work best. But I think it's still the same types of principles of how do we inform and equip, I would say, the public to discern misinformation in the first place.
Mm. Yeah, that's great. There were some questions about, like, how do you figure out if it's misinformation versus disinformation, and really, right, as you're saying, equip the public to figure that out on their own without us telling them what is misinformation. So there's an... Yeah. Oh, go ahead, Rupali.
No, go ahead, Anna. No, go ahead.
Well, there's some really great questions coming in, so I wanted to see if we could get to some of them. So there's one that says, in today's information age, people can Google and find almost anything. And what they're seeing is that there's misinformation that's coming out from people from reputable sources, right? Or people who have doctorate degrees, right? I remember early on seeing a YouTube video with like two like ER docs or whatever it was, discussing how like social distancing isn't needed. I mean, it was like, I couldn't even watch it. But I mean, there are people who have degrees. And so what this individual is saying is it's almost harder to deal with highly educated people who are spreading misinformation. And what strategies might you have for different societal groups?
Do you want to take this one, Molly? Okay. So the one way we can think about this is the same way that we would communicate when we're thinking about this in any other type of an aspect, right? We want to segment the population in a way that we're able to equip them with the skills and the solutions that are most relevant to them, right? So one thing that I would say, when we're dealing with those that tend to have concerns about vaccines, they tend to be very strong in their beliefs, right? So their attitudes are very strong related to vaccines. One of the things that we try to do is we understand that folks that are sort of, if you remember that slide that we showed related to vaccine hesitancy, and that it is a continuum, it is harder to change minds with people that are on the extremes, right? So the argument that I would make is, how do we sort of focus on that middle portion, which tend to be maybe uncertain about a specific topic, or they might just have ambiguity, meaning they're sort of like, I could decide to self-isolate, or I could decide to not self-isolate. So I would say the argument would be is that we need to focus on that population. I would segment the population out a bit, because like I said, it's going to be really, really, really hard for us to change people's minds that are either on this end or on that end. We have to focus on the portion in the middle. There's been a lot of audience segmentation strategies that have been used to try to identify the underlying attitudes that predict the way someone is going to behave about a specific topic. And I would argue doing it similarly here. Thinking about the ways in which how their attitudes are formed, for example, how strongly they believe in those types of attitudes will help you decide what that communication should essentially entail and the way that you should structure it, for example.
Molly, anything you'd like to add?
I think that was great, but I think too also to the point about how to discern information, even if the source seems like a reputable source. One of the things that this is not a unique challenge to COVID, and we definitely see this on the vaccine side as well. I think a lot of it is, as we talked about this inoculation theory idea of trying to train and educate individuals to recognize that there are multiple factors that can affect it. So you may hear a message from a very reputable source, but if you kind of understand what to look for and what may be some of the approaches that are used in disinformation or misinformation challenges, you might recognize in what they're saying, not just the voice that it's coming from. So a lot of times, for example, the example that seems to always come up with vaccines, and we talk about the Wakefield study. So that's an individual who was a scientist with training and a doctorate and from an institution that people knew and published in a journal, at least at first, that had a similar reputation. But there are that ability to sort of read between the lines and understand what was being communicated and recognize some of those faults in the information is a skill that we're able to learn a lot from that experience that we maybe can apply in these of looking at, well, this seems like maybe this study wasn't quite so clear, or this has been refuted by other studies or other voices, so maybe I need to think about it a bit more carefully. There are some lessons that we can take from that.
Okay, there's a question about innovation. So have there been any information innovations equivalent to anti-counterfeit innovations, like digital equivalent to a watermark, or anything else that you guys have seen in this space that could be helpful?
Yeah, I know that. So we have had several phone calls with some social media companies that are employing this idea of essentially chatbots. So sort of think about like on WhatsApp, you get some type of message that comes through. You might get a little chatbot that would say, hey, this looks like this might not be true. Let's help you figure out whether or not it's true or not. I know that's been tested. There's been a lot of those types of interactive chatbots that we're using, for example, with regards to when people have symptoms that we're also employing, when we're asking people to go to a specific website, type in their symptoms that help them triage essentially and determine if a patient needs to essentially have a warm handoff, meaning that they might actually need to get a test. So similarly, I think using some of these artificial intelligence approaches that essentially come up. I know Facebook for a while had, and I think they still do, they have that little eye, if I remember, that will say about this website. So if someone posts something and it's a story and the story is linked to a website, it will literally say about this website and you can click on it. And it gives you a little bit more of an assessment regarding the validity, I would say, of the information that's coming from that website. So there is some of that. However, as you can imagine, Anna, the biggest challenge that we have in this is that this has to be, we can try to teach a machine how to do this. But it's not only is it text, but it's also these memes, these visual memes that are going out, that are more graphic in nature, that we're trying to figure out how do we essentially program some sort of machine to detect and say, you know what, this is a flag, this may not be true. What are the ways in which we can flag it to people so that they can discern and actually take a step back and say, is this really true that I'm seeing? But as you can imagine, this has become really unwieldy. And I think the WHO, called this an infodemic within the context of COVID, because it has become so out of control, the amount of misinformation that people are spreading and seeing, that it's going to be really hard to control it, from more of, I would say, like a, either you do that through traditional media or you're doing it through social media. I think it's just going to be, unfortunately, a bit of a challenge to really be able to wrap our hands around it.
And I think, too, to Rupali's point, one of the other challenges that we face in this particular, as we said, the infodemic is, there's a need to control the misinformation, but in some cases, that act of controlling the misinformation effectively, echoes the feelings people already have, that what they're hearing, the resources they're able to access is being controlled by somebody else. So it's that infringement on liberty in some minds. So it just can, in some cases, hit that echo chamber again, which makes it even more challenging.
So I think we're reaching the end of our time, but I want to leave on just sort of a final wrap-up question that'll probably be very challenging to answer. So given, the depth and breadth of misinformation that's going on, and we're even seeing it in the chat box, right? People from around the world are saying they're hearing different things about herbs, soups, heat, all of these different things. What can we as researchers, practitioners do? What feels more tangible, right? Because I know I receive questions from neighbors all the time, right? And it just feels like that I have to, there's a responsibility to keep up, right? Of course, as researchers and people in the field, we want to do that. But, what sort of final tidbits of advice would you give for people trying to be helpful in the space, whether it's to patients, communities, colleagues, and so on?
Yeah, I would say this, and this was actually a colleague said this to me that was in my doctoral cohort several years ago. He mentioned something like the science and what we do is important, but how we communicate about it is also as equally as important. And I think as public health scientists, practitioners, whatever, if we're clinicians, whoever this is, that is part of our job, is to think about the ways in which that we combat this misinformation as much as we can. Again, think about the ways in which that we can empathize with people and understand that people are grasping for information, but that is essentially part and parcel of being in public health. And I think sometimes, we're very much about, here's what the data show, here's what the science show, but we also need to be able to essentially be good community spokespeople and essentially opinion leaders within our own little ecosystems, if you will, of trying to manage. And you're right, Anna, I feel like we all get a lot of questions and it's exhausting. And I feel like at the end of the day, I'm like, oh my gosh, my neighbors have more questions. However, I also have to remember that that is because they perceive me as someone that might know something about this. So it's even more important for me to continue to talk to them in ways that, one, is digestible, that's clear, and that's transparent.
Absolutely. And I would add to that, that one of the things that we need to be mindful of is to follow our own recommendations. So especially in a time when there are a lot of guidelines and keeping track of them, and sometimes they're uncomfortable or inconvenient. But if we're expecting people to look to us as thought leaders and to follow these interventions and look to the health of the community overall and not just our individuals, it's really critical that we follow those as well.
Great. Well, thank you both so much for joining us this morning. It was such a pleasure. A lot of information thrown at us, a lot of misinformation that we got to see from different people, not from you, I'm sure. So thank you again. for joining our series this morning. For everyone who is on the call, our next session will be on Thursday at the same time, same place at 9:30, and we'll be talking about convalescent plasma therapy. So we hope that you'll join us, and thank you both again, Molly and Rupali, for this morning's session.
Thanks so much.
Thank you.